Good afternoon and welcome to our community forum uh, in conversation with our county. Today we have Ricardo Romero Morales. Welcome, Ricardo.
Thank you,
Thank you for
Corina.
being our guest here today. And we know that you have several updates for us, kind of exciting times, especially for those of us that have little ones. But before we bring you in, we're going to give a brief update, just general update, as we usually do. So bear with us. I know you'll be back soon and we'll be able to hear from you. Thank you, Ricardo. And we have Gloria helping us with the technical support. So hopefully she'll be showing our presentation that we have for you soon. And if we don't have it up yet, that's okay. We'll go ahead and go to your updates first, and then we'll do the general presentation that we do every 2 weeks after. So I'll give her a couple seconds, and if I don't see that up, there we go. All right. Thank you. Thank you, Gloria. So today our updates, just general updates that we give bi-weekly in our county are, if I can get this next page, our daily update is that those that are 12 and older with at least one vaccine dose, 89.8% of our population here in Santa Clara County have received at least one vaccine. And then 85.2% of those 12 and older have completed the vaccination. So have either received the one or the two needed, depending on the vaccine that they get. And in regards to our numbers, 138 new cases is our 7-day rolling average for as of yesterday. Next slide, please. And then in this graph, you'll see that those that tested positive for COVID-19, 24.3 of those cases were unvaccinated, and only 4.9 were fully vaccinated. What does that mean? Just highlighting the fact that those that are unvaccinated are getting COVID at a higher rate, and that even those that are vaccinated are still getting COVID. But what I want to highlight there is that their symptoms are not as severe. They're not ending up in the hospital or dying. So not just are the unvaccinated getting the cases of those that have gotten COVID are higher, but even those that were fully vaccinated, the ones that got COVID, their symptoms were not as severe. Next slide, please. And just in regards to COVID-19 vaccines, as if you've joined us before, you've heard about the boosters. But in regards to the COVID-19 vaccine in general, they reduce your chance of getting COVID. They protect you from getting seriously ill, and they reduce the chance of spreading COVID to others. Next slide, please. And then how do you know if you're eligible for a booster shot? Some of you did tune in when we talked about boosters, but just a reminder, those who have received Pfizer or Moderna and are 65 years and older, 18, who live in a long-term care setting, who have underlying medical conditions, and who work or live in high-risk settings, know that things are changing on a daily basis. So Ricardo might be here to give us any a new announcement other than when this information went out. But for sure, if you fall under this, you are eligible for a booster shot. Also, if you received the J&J vaccine and you're 18 and over, at least 6 months after the Pfizer or Moderna. So if you received any one of those 6 months or more, and at least 2 months for the J&J. And where you can contact your provider, medical provider, or visit secfreevax.org to find a location near you. Know that some locations that we're providing walk-ins might not. And so just if you can go in there, be up to date to get that information that you need in order to get your booster shot. And then in regards to, if you're feeling sick, just a reminder, if you have any of the, symptoms of COVID-19, the fevers, chills, coughs, loss of taste or smell, sore throats, headaches, nausea, muscle or body aches, fatigue, make sure to get tested. And again, you can go to our websites to find a location near you. So you can go to scfreetest.org and go and find a place to get tested as soon as possible. Unfortunately, this past week, I've heard people say, oh, well, somebody tested positive near me. I didn't go get tested. I waited, a week or two. And unfortunately, they tested positive. And unfortunately, they went to events during that week. So I say this because it is very important that if you feel you do have COVID, you might, you were exposed to it, stay home, follow all the guidelines that we know by now. And if you don't, right, stay home, don't go to events, especially if they're indoors, because unfortunately, people are still getting sick, and not everybody's vaccinated, as we know. And we do know people that are ending up very ill in the hospital. And so that's a call for all of you who are not vaccinated yet. Please get vaccinated. And those of you that end up with, COVID, to make sure to get tested as soon as possible, as soon as you're available, able to do so. Next. And then if you've had COVID-19 in the past, I hear, well, I've already had COVID-19, so I'm not going to get it again, or I don't need the vaccine. And so just a reminder that if you have been diagnosed with COVID-19, you can get vaccinated anytime after 10 days that have passed since your diagnosis and you have recovered. Because why? You could still get COVID-19, you could still pass it to others. And so it's important that, we understand that even though if somebody's had COVID-19, that it's important that you still get vaccinated. And so this applies to all COVID-19 vaccinations, including the boosters as well. Next slide, please. And so here are some resources in our county. I just like to highlight resources again. You never know when you or somebody that you know might need them. So I encourage you to write down some of these numbers. The COVID test or vaccination appointment, 211, that's easy. Somebody will answer. That's available 7 days a week, 24 hours a day. Mental health services, 1-800-704-0900. Know your rights in the workplace, 1-866-870-7725. Substance use services, 1-800-488-9919. COVID support line, 408-808-7770. Crisis hotline number 24/7, and that's 1-855-278-4204. Or you can text renew to 741-741. So especially, I think, some of those 24/7 numbers, that somebody can answer. That 211 is an important one I would write down. The crisis hotline, you just never know when you or somebody might need it. Next slide, please. All right, thank you so much. And now we'll bring in Ricardo Romero Morales. He is our Deputy PIO, our lead Public Information Officer here at our Emergency Operations Center. Thank you, Ricardo, for everything you do for our community. I know you're busy, and so don't want to take too much of your time. Want to hear about the latest updates, some things that we get to look forward to maybe in the next week or so.
No, thank you, Corina. And I think you did an amazing job talking about the boosters. And that was one of the announcements that I was planning to make today as well. And at this point is now just a reminder. And first of all, I want to start off by, that I want to acknowledge that people have questions about boosters because there are 3 different vaccines, different time intervals, and different eligibility groups. And there's also a third dose. So we understand that the public may have questions, and we want to make it as clear as possible, and we want to give a public a simple message and clear things up. The bottom line is that most people who've received an initial series of COVID-19 vaccines are now eligible for a booster, and for many, boosters is strongly recommended. Now, just to break it down a little bit more, boosters are recommended for everyone who is 18 and over who had their Johnson & Johnson vaccine at least 2 months ago. And they can be boosted or vaccinated with a booster with any of the 3 available vaccines. Those include Johnson & Johnson, Pfizer, or Moderna. Now, Boosters are also recommended for a very large number of people who received either Pfizer or Moderna at least 6 months ago. They can also be boosted with any of the vaccines, Johnson and Johnson, Pfizer, or Moderna. Now, for a subset of people, boosters are especially important and strongly recommended for those who are 65 and older, or those who live in a long-term care facility, or anybody who is 50 years of age or older who has an existing medical condition. It is recommended that they get their booster as soon as possible. Now, it is important also to highlight that boosters are available throughout the entire county of Santa Clara. All of our mass vaccination sites, including the fairgrounds, are offering boosters. And we also have our MOVAX team who is going out to different community events where people can also get vaccinated if they haven't done so, or they could even receive a booster shot if that is what they need at this time. Now, it is also important to mention that vaccines and boosters continue to be free, regardless of immigration status and regardless whether they have health insurance or not. So that is pretty much my spiel about the boosters. But I did also want to mention to our audience that yesterday the FDA made the recommendation to the CDC of approving the vaccines for kids who are between the ages 5 to 11. Now, that just happened yesterday. The next step is for the CDC to adopt this recommendation, and we expect that to happen as soon as November 3rd. So, sometime next week, that will be happening. And here in Santa Clara County, we are currently working with more than 70 schools to make sure that we have vaccinations and vaccine clinics available at those sites as well. And as well as mass vaccination sites, are all of our mobile vaccination units will be out there in the community vaccinating children. It is important that at this time, parents start to prepare themselves, come up with a plan, who's going to be taking their kid to get vaccinated, what documents or consent forms are needed, as well as the location that the vaccination clinic is closer to you. Now, we also do acknowledge that there are many questions for parents, and parents are wondering, is it safe for my child to get vaccinated? Are there any side effects? And yes, there could be side effects similar to what we've seen in adults, which includes a sore arm, there could be headaches, fever. So those are some of the side effects that we have observed in the children's that were part of the study. Now, in terms of specific questions, those go case by case basis. So the best recommendation that we have is to talk to your pediatrician or to your doctor to make sure that those questions are being addressed.
Thank you, Ricardo. And I just want to remind the audience that they can ask questions in relation to what you presented today, or even what I talked about. Please make sure to put down your questions so we can, take advantage of the time here with Ricardo. I do have a couple of questions that kind of came through some of the comments and things. Maybe just a reminder. I know some people are wondering, why are you wearing your mask on video? Can you let us know, why, and maybe a reminder for those of us that think we don't need to wear our masks anymore, or what that is. Why are you wearing your mask?
Great question. No, so currently I am working indoors and where there's other people around me. So that is the reason why I'm wearing my mask. As a reminder, currently here in Santa Clara County, anybody, regardless of vaccination status, is mandated to wear a face mask indoors. If you're outdoors, you can definitely remove your mask regardless of your vaccination status. Now, a couple weeks ago, our health officer made an announcement outlining the criteria that is needed in order for mask mandate to be lifted or removed, and um, that currently includes making sure that we have a low community transmission of COVID-19 cases and that our hospitalizations are low and stable, and as well as making sure that we reach 80% of our total population being vaccinated. Many people have been commenting on our social media saying, well, we're already past the 80%. Currently, our dashboards are showing the 12 and above because those are the people that are eligible up to this point. But we want to make sure that we have all of the community, meaning 0 and above, to be able to get vaccinated. So that's why it's so important for our young children to get vaccinated. We will need at least 55% of the 5 to 11 population to get vaccinated in order for us as a whole community to reach about 80% of people to get vaccinated and be able to lift the mandate that we currently have.
Thank you, Ricardo. And I know some parents are wondering, is a dose the same that they give the adults, or is it different for children?
Great question. So for children, it will be a different amount of dose. So it would actually come in different packaging. So this vaccine is special. It has been made special for children. So therefore, we cannot use the bios or the vaccines that we have for adults. We have to use specific vaccines that are coming designated for children.
Great. Thank you for that. I have a question here from Rob Avina, and he's wondering if the vaccines for 5 to 11-year-olds get approved, will the vaccines be available for them here the same day, and can we camp out in line?
Yes. So the answer to that is yes. We don't know what time the CDC will make that announcement, so it will be hard to say. But what we can tell you is that starting tomorrow, you can actually start booking those appointments on our website, secfreevax.org, and where people can go and start booking those appointments for November 4th. If you already have children, you can make your appointment starting tomorrow for November 4th and moving on.
Thank you so much, Ricardo. And just a reminder to our audience, please put down your questions, anything that Mr. Romero Morales has talked about or that even I mentioned before we close out today. And I do, want to thank everybody that's tuned in today. And, it's important to know the information. And at the end of the day, we all still get to make our decisions, right? Especially as parents. I know my daughter, she's 12, so she has it. And I'm looking forward as a community member to support the children. And I really like the fact that you said that they will be available at some of the schools, because sometimes as parents, we're on our way to drop off our children, and then from there we have to go to work, and by the time we get there, so it's easier, at least I know for me as a parent, if the vaccine was available at the school. And so it'll be hopefully a resource that we're able to bring to our communities through the schools as well. So I want to thank the schools for collaborating to be able to do that, because I know it's also a lot of work, right? In addition to what our schools are doing, we're asking them to also, coordinate a little space there for this to happen. But I really appreciate everybody that's, making this so easy. And so thank you, Ricardo, for collaborating with the schools as well to ensure that these are available at some schools. And so let me review and see if we have any additional questions here. I don't see any specific to what you said. And let's see. I don't see questions. I do see comments. Thank you for your comments. Please put any questions that you might seem. Let's see. Yeah. So please put your questions down. Thank you for your comments. Thank you for tuning in today. Ricardo, any last closing thoughts for our community today, maybe in relation to what you mentioned or, the announcements coming up?
Yeah, so just a reminder that we will have enough doses for vaccines for children's 5 to 11. People can also reach out to their doctor, to the primary doctor, to make those appointments through them as well. Or they can also visit one of our county sites, or even get information from their schools to know when we're also going to be going to those schools. So also local pharmacies will be offering the vaccine for children. So there will be plenty of different locations in where you can get your children vaccinated. So make a plan. This is the exact timing to make a plan, because we are probably a week out of the rollout. So please do make a plan. Make sure that you have, you may want to start looking out for that yellow vaccination record. as they're also going to be writing down those vaccines and those records. And in addition, they will also be receiving a CDC card.
Thank you so much. And I know that you mentioned, there's this week, it's kind of like, I feel like once the county opens up for the 5 to 11, there might be less appointments, or it might be a little harder to just walk and get my vaccine, right, if I haven't gotten it. So maybe encouraging folks to, if they are still on the fence or, waited, to make sure they get it before that push comes in, because we know that, our children will get, a lot of these appointments available. And so that might leave less for some of us adults that maybe waited. And so go get it now. Ricardo also mentioned different events coming up. I just want to highlight a trunk or treat event coming up in our community this weekend on Saturday from 12 to 5 at the Hillview Library and at the Alum Rock Library. And I believe there will be vaccines there. Is that true, Ricardo?
That is true. So we'll be having vaccines there as well. And then just to piggyback on what you just said, Corina, which is really, really important, is that if you haven't had a chance to go get your booster shot and you're really wanting to get a booster, go ahead and do it now, because starting next week, we're probably going to start seeing a lot of parents taking their children to all of our vaccination sites. So you may see a little bit more of a crowd at different sites. So take the advantage now to get your booster shot and start to make those appointments starting tomorrow for vaccines for children 5 to 11 years old.
Great. Thank you so much. And then talking about Halloween, we know that many of you have plans this weekend. Hopefully it's outdoors, there's air, and you keep your distance away from folks if they're not in your family, etc. We're not where we were a year ago, but we're still not right clear. And then if you're going to any indoor parties, please, be safe, wear your face mask indoors, because unfortunately COVID is still, prevalent in our communities. And so just be safe, enjoy yourselves. But remember that, we're still not in the clear. Get your vaccine if you haven't yet. And then for those of us that celebrate the Day of the Dead, Dia de los Muertos, thinking of all of our loved ones who have passed on. Also, by the time we have our next community forum, that will have passed. Especially remembering those that have passed on to COVID-19, especially those of us who had close relatives. Our hearts are with you as you remember them as well. And with that, we'll go ahead and end our community forum today. Thank you again for joining us, and we'll see you in 2 weeks. Have a good one. Thank you, Ricardo.